Attention, all Webb residents and all seniors everywhere. By now you may have received your 2025 Medicare brochure and various notices from your Medicare and Medicare Advantage providers. You should get ready with your heart and anxiety medications before you read this and read the new programs that are being offered. The news is not good. While Medicare is a federally administered program, but Medicare Advantage and Part D drug plans are not. They operate for a profit and are administered by private healthcare insurance companies. These Advantage programs add to the cost of healthcare. You as a taxpayer are now supporting giant companies that are making huge profits. 2023 was a record year. Out of your tax dollars that you used to pay to Medicare, healthcare costs are out of control due to these programs. And don't even try and buy a bottle of generic aspirin, now $10 at my local pharmacy. That was $1.99 2 years ago. This year's October surprise just came in the mail. Many Advantage and drug plans have been discontinued. There are others still available at various price points with unfathomable options and costs. All have gone up in price and changed coverages and copays for the worse. Deductibles have gone through the roof with cutoff points as high as $14,000. Drug prices, drug coverage, and tier levels have been juggled so that the insurance and pharmaceutical companies continue to rake in profits. The entire system has been a disaster for years. But the current administration, with their regulations and new laws, for example, the Inflation Reduction Act of 2022, which has now precipitated this crisis. Theoretically, only two good things came out of that bill. 1. The time that the insurance company must respond, but may not approve, a request for treatment has been shortened from 14 to 7 days. Unfortunately, it doesn't say or limit how many times you have to request approval for it to happen, even if it would automatically be covered under standard Medicare, in violation of the law. 2. Under the new act, as of 2025, drug costs were to be capped at $2,000. Which sounds like a good idea until it goes into effect. It's one of the reasons a number of Advantage plans have been discontinued, and some companies have refused to issue coverage. The final plan coverages were supposed to be submitted in June, but have only now been available to enrollees. Amazingly, the plans are still outrageously expensive and complicated, even after our current administration illegally transferred billions to these corporations just to keep them in the program. And if you think that cost cap is good, just wait until you see the prices on the drugs. If your necessary drugs are covered at all, it is intended that virtually everyone in the plan will hit that $2,000 cap early in the year. Remember that $10 bottle of aspirin. Except for the individual cost caps put on 10 drugs a year, insulin is capped at $35 monthly, for example. Everything else will be much more expensive in the program, with another unintended result that drug prices for everyone else will go up as well. Examples of 2025 plan limits. Original Medicare. Medicare Part A, no charge hospital. Medicare Part B, $174 medical monthly. Medigap range $92 to $711 monthly covers the 20% not covered by Part B. Drugs Part D, $21 to $151 monthly, plus deductibles. Medicare Advantage 2025 plan limits. Original Part A is still no charge. Original Part B is still $174. Advantage programs range from zero out of pocket to several hundred. May or may not include drug coverages, but if you go with a plan without drug coverage, you cannot buy into the Part D drug plan. If you go without a drug plan, if and when you want to switch plans at a later date, Medicare will charge you an increased coverage rate forever. Co-pays and deductibles vary wildly, but all towards the expensive side. Example, $300 for an MRI, X-rays, $100, etc. Total yearly deductible range from $3,000 to $14,000. And remember, this is per person, not household. If you are tired of our government and big business colluding to take advantage of the people, especially senior citizens, it is time for action. Go to thefreedomindex.org and look up your federal and state representatives. See what they have done, not what they say. Call them, write to them, and then vote your conscience on November 5th. But just don't go home and think you have done your civic duty. Keep after them, because I assure you they are always after us. Review all your information and talk to trusted advisors before you make a decision. You have until December 7th to sign on the dotted line for 2025. For more information, go to info@firstamendmentfreepress.org. I am planning a 6-part seminar explaining the United States Constitution at Webb, Nexton, for early next year. I have been presenting this class in Somerville to a packed house. I would like to offer it to my neighbors in Del Webb and possibly Cane Bay. Call me at 732-456-8073 for more information. If you are interested, let Betty and Michelle know at the clubhouse as well. Yours truly, Len Marshall.